Welcome to this short tutorial of the posterior tibial nerve block, where we will review how to perform the block under ultrasound guidance. The posterior tibial nerve branches off into the lateral plantar nerve, medial plantar nerve, and medial calcaneal branches, which provide sensory innervation to the vast majority of the plantar surface of the foot, as depicted in the diagrams. A posterior tibial nerve block can be used for a number of reasons, including painful procedures, such as incision and drainage of an abscess, repair of a laceration, or removal of a foreign body. The main anatomical landmarks to perform this block include the posterior tibial artery, posterior tibial nerve, and medial malleolus. You should orient the linear probe in the transverse plane just superior to the medial malleolus with the probe marker towards the patient's anterior. The posterior tibial nerve should be visualized posterior to the posterior tibial artery. How to perform the block. First, position the patient supine with the lower extremity externally rotated at the hip and flexed at the knee in order to best visualize the medial aspect of the lower leg. Scan with your linear probe in the transverse plane about 3 centimeters proximal to the medial malleolus and visualize the medial malleolus, posterior tibial artery, and posterior tibial nerve. After properly cleaning the target area, using an in-plane approach, insert the 20-gauge needle from the posterior aspect of the lower leg, being careful to avoid the Achilles tendon. Finally, inject 5 to 10 cc's of the anesthetic in the area and watch for hydrodissection. Here is a clip with the Doppler on, depicting the posterior tibial artery and the vein. As seen in the videos, visualize the hyperechoic needle below the posterior tibial nerve and watch as the anechoic fluid hydrodissects the plane below the nerve. Anesthetic selection. Using either 1% lidocaine or 0.25% bupivacaine, make sure to use a weight-based dose as to not exceed the maximum dose for the respective anesthetic.